The 1980s killed more Australians than the First World War. Not in combat, not in a single catastrophic event, but across 10 years of preventable deaths, on roads, in hospitals, in mining shafts, on construction sites, in homes. Australia lost more people to known, documented, preventable causes than it lost in 4 years of industrial slaughter between 1914 and 1918. Australia lost 61,919 people in the First World War. In the 1980s, more than 62,000 Australians died in road accidents alone. Read that again. Road accidents alone. One category. 1 decade. More deaths than Australia's worst military conflict. And that is before you count the workplace deaths, the asbestos deaths peaking as the latency period from post-war construction caught up with its victims, the HIV/AIDS crisis the government was slow to fund, the domestic violence deaths not counted as a category at all, and the Aboriginal deaths in custody occurring at rates a Royal Commission would eventually call a national crisis. The 1980s is remembered for the mining boom, the Hawke government, Crocodile Dundee, the America's Cup, the reforms that made Australia the country it became. Both things are true. Prosperity and death toll happened simultaneously. This video is about the death toll, the documented, preventable causes that made the 1980s the most lethal peacetime decade in modern Australian history. Stay to the end. Number 1 is not a dramatic single event. It is a systemic failure whose victims are still dying today, from a substance the industries using it knew was lethal and used anyway. Subscribe. Let's begin. The 1980s were a decade of transformation. The Hawke-Keating reforms floated the dollar, deregulated the banks, and restructured the economy. The bicentennial in 1988 produced the largest national celebration in Australian history. Women entered the workforce in unprecedented numbers. Underneath it, people were dying, in numbers the prosperity narrative never contained, in ways the government knew about and was slow to address. 12 things that killed Australians in the 1980s that nobody was counting hard enough. Number 12. The road death toll and why it was preventable. In 1980, 3,321 Australians died on the country's roads. In 1989, the annual toll was still above 2,500. Across the decade, road fatalities exceeded 62,000, more than Australia's total First World War deaths, achieved not in 4 years of warfare but in 10 years of driving on roads the government knew were dangerous and was slow to make safe. The causes are documented. Endemic drunk driving with inconsistent breath testing, seatbelt compliance lower than in later decades, vehicle safety standards lagging comparable countries, and rural highway infrastructure that did not match the speeds traffic was moving at. The deaths were distributed across the population. Farmers, suburban families, young people, truck drivers, not concentrated in identifiable risk groups. The political failure was the delay between knowing the problem and implementing solutions. Random breath testing, which transformed the toll once properly implemented in NSW and Victoria from the mid-1980s, existed as policy before it was applied effectively. By decades' end the toll was falling. The 62,000 who died were not inevitable. They were preventable. Number 11. The asbestos disease epidemic and the industry that knew. By the 1980s, asbestosis and mesothelioma were killing Australians in numbers the responsible industries had predicted, concealed, and continued causing even as the predictions came true. Mesothelioma's latency period is 15 to 50 years. Workers who inhaled asbestos fibers during the post-war construction boom, in shipyards, factories, and building sites across every city, began dying in the 1980s from exposures in the 1950s, 60s, and 70s. The industry, centered on the Wittenoom Blue asbestos mine and James Hardie, had documented internal knowledge of asbestos's lethal character predating its widespread construction use. James Hardie has faced sustained legal and journalistic scrutiny for continuing to manufacture and market asbestos products while that knowledge existed. The 1980s were the decade the epidemic became publicly visible. Deaths of prominent union officials and health advocates gave the disease a public face. The Asbestos Diseases Society of Australia, established in 1984, was the organised response to a crisis the industry had anticipated and regulators had failed to prevent. The deaths have not stopped. Australia still has one of the highest per capita mesothelioma rates in the world, a direct consequence of asbestos use that peaked in the 1970s. Number 10. The HIV/AIDS crisis and the response that came too late for the first wave. The first Australian AIDS death was recorded in 1983. By 1990, over 1,000 Australians had died. The epidemic, documented in the US from 1981, reached Australia with a delay the public health response did not use adequately to prepare. The government's early response was shaped by the concentration of cases among gay men and injecting drug users, populations facing specific marginalization, by scientific uncertainty about transmission and treatment, and by the political difficulty of funding a disease-conservative moral framing associated with reprehensible behavior. What Australia did better than most was the eventual response. The 1987 Grim Reaper campaign, the bowling ball, the falling figures, the voiceover warning this disease did not discriminate, was one of the most effective public health campaigns in Australian history. Needle exchanges, safe sex education, and the community-based response the gay community developed produced an Australian AIDS response recognised internationally as among the world's most effective. But the people who died between 1983 and 1987, before that response existed, died amid public stigma and a government slower than the crisis warranted. The first 1,000 deaths partly the product of the years it took to mount that response. Number 9. The workplace death toll and the industries that produced it. Australian workplaces in the 1980s killed workers at rates that, compared with later safety standards, represented a systematic failure of the frameworks meant to protect them. Construction, mining, manufacturing, and agriculture all produced fatalities higher than comparable industries in comparable countries. The gap was between what was known and what was done. Legislation existed. The causes of workplace deaths, falls, machinery accidents, chemical exposure, confined space risks, were documented. Enforcement was inadequate. Mining's record included catastrophic events, the Mura coal mine disasters, Kalgoorlie underground fatalities, alongside individual deaths that never made headlines but represented preventable losses to specific families. Construction's toll was partly a product of the building boom the reforms enabled. More activity, more exposure, safety lagging behind. The frameworks now governing Australian workplaces developed partly in response to this toll. The workers who died before they arrived represent the cost of getting there. Number 8. The domestic violence deaths that did not appear in the statistics. Australian women were being killed by intimate partners in numbers not counted as a category. Deaths were recorded as homicides, the relationship documented in police records, but no national framework tracked intimate partner homicide as a pattern rather than a series of individual tragedies. The Australian Institute of Criminology's later research produced historical estimates suggesting intimate partner homicide killed women at rates substantially higher than today. Higher because the social and legal frameworks that have since reduced the rate did not exist. The failures were legal, institutional, and cultural. Restraining order frameworks were underdeveloped. Police often treated family violence as a private matter, not a criminal one. The support infrastructure that exists today did not. Women being killed were often in contact with institutions that failed to connect what they were experiencing to lethal risk. These deaths are not in the decade's official toll in any visible way, counted in homicide statistics, not a category the decade recognized. The invisibility of their deaths was part of what produced them. Number 7. The Aboriginal deaths in custody that produced a Royal Commission. The Royal Commission into Aboriginal deaths in custody was established in 1987 and reported in 1991, examining 99 deaths across Australia, a response to what had been happening in police cells, prisons, and youth detention facilities through the preceding decade. The 1980s were when the pattern became nationally visible, not because deaths began then, but because Aboriginal advocacy, journalism, and pressure from the reconciliation movement forced the issue into national politics. The cases examined included deaths from hanging, medical neglect, and the conditions of custody in remote and urban facilities, each a person, a family, a community, together forming a pattern of systemic failure. The Commission's findings produced 339 recommendations. Implementation since 1991 has been partial. The rate of Aboriginal deaths in custody has increased, not decreased, since it reported. Number 6. The Murray-Darling Basin and the decade that set the course for its collapse. The 1980s were when the basin's water over-allocation became irreversible. Irrigation accelerated as deregulation made agricultural expansion more accessible, while entitlement frameworks failed to limit extraction to sustainable levels. The ecological damage visible today, algal blooms, fish kills, salinity, degradation of the Coorong and lower lakes, has causes rooted in 1980s allocation and infrastructure decisions. The decade decisively worsened a problem it did not begin, at a time when the science of the system's limits existed but was not applied to policy. Deaths directly attributable are hard to quantify, but downstream communities, fishing livelihoods, and Aboriginal communities for whom the river held cultural significance all experienced these decisions as accumulating harm. The 1980s did not kill the Murray-Darling, but its decisions made the current condition far harder to reverse. Number 5. The mental health deaths the decade did not acknowledge. Australia's suicide rate in the 1980s was higher than in subsequent decades. Causes include the early 1980s recession, social change in gender roles and family structures, the absence of mental health services in rural and remote communities, and the fundamental inadequacy of psychiatric and community infrastructure for the scale of need. The decade's response was shaped by deinstitutionalization, closing large psychiatric institutions and replacing them with community-based care that was never adequately funded to receive the people leaving them. The consequence was a population of seriously mentally ill Australians without institutional or adequate community support, in boarding houses, on the streets, in emergency departments, in prisons. Some died from suicide or untreated illness. These suicides appear in mortality statistics, but the relationship between the decade's policy failures and the deaths they produced is far less counted, the foreseeable consequence of closing institutions without building the replacement. Number 4. The water contamination events that killed Australians in the 1980s. Australia's water supply was less regulated, monitored, and safe than in later decades. Contamination events included industrial river pollution, agricultural chemical runoff into drinking supplies, and algal blooms in systems that were not adequately managed. Blue-green algal events along the Murray-Darling and industrial contamination in manufacturing regions contributed to a decade in which water safety was a genuine, inadequately addressed concern. Specific contamination deaths are hard to isolate statistically. Contaminated water produces illness, and illness produces deaths counted as gastrointestinal disease or organ failure, not water contamination. What is documented is the contamination itself. The regulatory responses came after the harm, not before. Number 3. The early 1980s recession and the deaths it produced. In 1982 to 1983, Australia experienced its worst recession since the Depression. Unemployment reached 10.4%, the highest in over 40 years. Mass unemployment's consequences included elevated suicide, cardiovascular disease linked to chronic stress, domestic violence, and the social deterioration that follows when large numbers simultaneously lose income, purpose, and identity. The connection between recession and mortality is well documented. Lost income reduces healthcare and nutrition access. Chronic stress raises cardiovascular risk. Isolation raises suicide risk. Economic stress raises domestic violence and its lethal consequences. This mortality contribution is not counted in any official category. Heart attacks worsened by unemployment stress are counted as cardiac deaths. Suicides with job loss elevated risk as suicides. Women killed by partners whose stress was amplified by recession as homicides. The recession killed people, distributed across categories rather than concentrated in one visible number. Number 2. The changes the 1980s death toll produced and the changes it did not. The decade's mortality produced regulatory, legal, and institutional changes that transformed Australia's safety record across many categories. The road toll fell after random breath testing and improved vehicle standards. Workplace safety legislation strengthened. The HIV/AIDS response became one of the world's most effective. The Royal Commission changed the formal framework for treating Aboriginal people in custody. These were real improvements that saved lives. Contemporary rates in the same categories showed genuine progress, partly a direct response to the 1980s toll. But the changes were uneven. Domestic violence deaths uncounted then are counted now, and intimate partner homicide, though lower than historical estimates, remains one of the most persistent lethal threats to Australian women. Asbestos deaths peaking in the 1980s and 90s continue into the 2020s, since the latency period means people are still dying from decades-old exposures. Aboriginal deaths in custody have increased, not decreased. The Murray-Darling is in crisis. The 1980s death toll produced changes. It did not produce all the changes it warranted. Number 1. Why the 1980s death toll has never been fully counted, and what that means. The 1980s killed more Australians than any war. This is true, and also an understatement. The categories here do not exhaust the decade's lethal character, and the hardest deaths to count are frequently the most preventable. The invisible categories, domestic violence deaths counted as homicides, recession deaths distributed across cardiovascular and suicide statistics, water contamination deaths counted as gastrointestinal disease, mental health deaths that occurred on the streets rather than in hospitals that discharged patients without support, are invisible because the counting frameworks of the 1980s were not designed to make them visible. This is not accidental. Counting deaths by category is a political act. The categories used to organize mortality statistics determine which deaths become visible as preventable and which remain individually tragic but collectively obscure. The 1980s had no domestic violence death toll because it had no domestic violence category. One created, partly, because of the advocacy the deaths prompted. The road toll is remembered. The workplace toll is partly remembered by the safety movement it grew. The asbestos deaths are partly remembered because James Hardy's legal proceedings forced accountability. HIV, AIDS deaths are remembered because the community that bore them built institutions to remember them. The rest of the 1980s dead are in the aggregate statistics, in numbers showing a decade more lethal than any Australian war, in families who lost someone to a cause that was preventable and whose prevention arrived too late. The 1980s ended. Australia continued, remembered for its prosperity and transformation. The people it killed are in the data. They are not in the narrative. This video is for them. Share this video. Subscribe. And next time you encounter a safety standard, a domestic violence service, a public health campaign, or a water treatment regulation, remember what the 1980s produced and what it took to make the changes that followed. See you in the next one.